So it's all about satisfaction, managing expectation, and then hopefully in the process that translates into increased satisfaction. And then I always say to them, you've come to me for a solution. So this is my solution. But whether they will go with it or not, it's a different story altogether. But it's important for me to present to them the different options, including one that I think best for them. And ultimately, the decision is on the patient. Then even more importantly, I listen to cues. I listen to whether there is a degree of resistance, a degree of objection. A degree of resistance and objection is not always a bad thing, because it shows that they are thinking. They're thinking about what you're talking about and what you're presenting to them. So if you're presenting a degree of resistance, I see that as a good sign. And I can try to give them a better understanding as to why I present them with that few options. And then if they are receptive to what you're in the consultation, again, we want to listen to the patient. It's all about listening, listening, and listening. What I normally do is I identify the idea, concern, and expectations of my patients. It's important that I ascertain what brought them to my clinic in the first place. And I want to establish if they have any degree of concern. Because if they have any concern, it's important that I address those concerns and make them as comfortable as possible. And then even more importantly, when it comes to the overall satisfaction of the patient, is that you know what they are expecting to achieve. Some patients may potentially be expecting something that you're not able to deliver. That's when it's important for you to make them aware of the limitation of a procedure. Even more importantly, we need to look at if there's any misunderstanding or misperception. A patient may potentially be